So the first unit that we're going to get into is upper extremity, and I just want to take a few minutes and go over some general considerations for when we are imaging the upper extremity body parts. One of the first things you want to make sure that you're doing is removing any and all artifacts that your patient may have. We're going to start with the hand, so some common artifacts could be things like rings. When you get into the wrist, there might be watches or bracelets, so any type of jewelry. If they have long sleeves, you're going to want to roll up their long sleeves. Anything that might interfere with your image, you're going to make sure that you're going to take that off of your patient. For our extremity exams, these are most commonly done tabletop, and you're going to have your patient seated in a chair beside the table. I will have a patient come over here and sit down to demonstrate this. The most important thing is that they are seated beside the table with their legs coming out alongside the table, not underneath of the table. The reason for that is if their legs were underneath of the table and now our source of radiation is coming down through the table, that's going to hit right into our patient, and we're trying to keep our patient dose in accordance with ALARA. So I have a patient here now. One of the things that you can see with our patient is that she is seated next to the table. And again, I have her legs coming out alongside of the table, not underneath of the table. One of the main things that you want to do is to build up your patient's arm all on the same plane and keep it at 90 degrees. Now that sounds a little confusing, so I'm going to demonstrate that for you. So if I were to pretend that I'm imaging Jen's hand, if I have Jen place her arm on the table here, you can see that there is an angle to her arm. This arm is not all up on the same plane. I basically want from her shoulder to her elbow and her elbow down to her hand, all level, all on the same plane. Some of the exam tables that you use, you can step on the exam table and the exam table will raise and lower. That is not the case with this table. So our next best option would be to look for a sponge. So if I go ahead and place the sponge underneath of Jen, you can see that this has helped our arm placement some, but again, we're still not all up on the same plane. There is still some angulation to her humerus. So I'm going to go ahead and actually grab another sponge. And what I'm also trying to do is keep Jen as close to these sponges as possible so that there is not a gap underneath of her armpit. So now you can see that we do have her arm all on the same plane here. So her whole humerus, forearm, everything is level. It's important when you're placing these sponges as well that you have the sponges fully supporting her arm. So I would not want Jen's elbow hanging off the back edge because that's going to mess up our relationship of our arm. Similarly, you would not want to have the sponges too far back that now her hand is hanging off of the front end of the sponges as well. So make sure that you've got this centered pretty well underneath of her. The next relationship that we want to look at is that we're keeping our arm at 90 degrees. Okay, so some of the relationships, the first one I'm going to look at is her humerus relationship. You want the humerus to be directly in line at 90-degree angles with her shoulder. So common mistake would be if her elbow is too far back. You can see now that the humerus is not straight and aligned with her shoulder. If her arm is too far forward, that also messes up this relationship. So if I have the sponges in a good position, I can just move her arm to be straight in alignment. If that was going to mess up the alignment so that her elbow or her hand were hanging off the sponges, the other option would be to move the patient's chair either slightly backwards or slightly forwards. But I'm happy with this placement with her arm and with the humerus placement as well. So once I have her humerus relationship where I want it to be, the other relationship that I'm looking at is with her elbow. My goal is to have her elbow bent to a 90-degree angle. If you look at her elbow now, you'll see that that's not at a 90-degree angle, that's at a larger angle than it needs to be. The other mistake would be if her arm is in like this, her arm again, the elbow is not forming a 90-degree angle. So I want to make sure that that elbow has a nice 90-degree angle. So the things I'm looking at, 90-degree angle in the elbow, humerus all perpendicular to the shoulder joint, and the entire arm built up and supported to be all on the same plane. So a third way that we can fix this solution to get her arm all up on the same plane. So again, my table's not going to raise or lower. I can't do anything about that. Imagine that these are the only sponges that I have available. I'm not just going to say, well, close enough. I'm going to fix this still. I want her arm all on the same plane. So the other option that I can do is ask Jen, can you slide down in your chair just a little bit for me? So if you have your patient slouched down a little bit, that's going to correct it, that you've got the arm now all on the same plane. So once we have our patient built up where we want them to be, we're going to set our source to image receptor, or SID, distance, And that SID is set to our cassette or image receptor, not to the table. So if you initially did a setup of your room, you were trying to get everything generally set, and you already set your SID, then you built up your patient, you have to go back and remember to check your SID to the actual image receptor. For upper extremity work, we want 40 inches. So I'm going to check this here, and you can see that I'm not quite at a 40-inch SID. So I'm going to go ahead and raise that up so that I am at 40. You want to make sure also that you're shielding all of your patients for the upper extremity exams. So I'm going to use a lap shield and place it across her lap, cover as much of her abdomen as possible. You'll see if I let go, that's probably going to hit the floor. So once I get it into position, I'm just going to ask Jen, could you place one hand and hold that in place for me? And your patient will be shielded.